Hey there, friends. Welcome back to the channel, or if you're new here, glad you stopped by. Before we dive in, I've got a quick question. Where are you watching from today? Are you soaking up the sun in Texas, braving the winters of Minnesota, or maybe kicking back in a small town somewhere in the heartland? Drop your location in the comments. I'd love to know wherever you are. Today's topic is something that touches every corner of America: Medicare. Picture this: you're nearing 65, or maybe you're helping a parent or grandparent figure out their next steps. Medicare keeps popping up, but it feels like a giant question mark. Who qualifies? How does it work? Why should you care? If that sounds familiar, you're in the right place. This isn't just about insurance. It's about peace of mind for you and your loved ones. So grab a coffee, get comfy, and let's break it all down together. By the end of this video, you'll feel ready to tackle Medicare like a pro. Let's jump in. All right, let's get to the good stuff. Medicare is a cornerstone of American healthcare, signed into law back in 1965 by President Lyndon Johnson. It's been helping folks like you and me ever since. But here's the kicker. It's not as simple as turn 65 and you're done. There's more to it, and that's what we're here to explore. Who can get Medicare? It's more than just age. So, let's start with the basics: eligibility. For most folks, Medicare kicks in at age 65. That's the golden ticket, 65 candles on the cake. And you're eligible, as long as you're a U.S. citizen or a legal resident who's called this country home for at least 5 years straight. It's a milestone millions of Americans hit every year, from coast to coast. But hold up, 65 isn't the whole story. Did you know there are exceptions? Some people can get Medicare way before then. Imagine you're in your 40s or 50s, and life throws you a curveball: a disability, maybe, or a serious health condition. If you've been on Social Security Disability Insurance (SSDI) for 24 months, boom, you're in. Same goes for folks with end-stage renal disease, kidney failure, or ALS. That tough disease we also call Lou Gehrig's. These exceptions matter because healthcare isn't one size fits all. Here's a real-life scenario. Think about someone like Mike, a construction worker from Ohio. At 52, he's been on SSDI for 2 years after a back injury. He didn't expect Medicare to be on his radar yet, but it is, and it's a game changer for him. That's the kind of curveball Medicare can catch for you. Now, what if you're 65 but still punching the clock? Maybe you're a teacher in Oregon or a nurse in Georgia, and you've got solid health insurance through work. Can you skip Medicare? Sort of. You might be able to delay it without penalties, but only if your employer's plan meets certain standards. We'll dig into that more when we talk enrollment, so hang tight. Legal requirements. The fine print. Eligibility isn't just about age or health. It's also about your status in the U.S. To get Medicare, you've got to be a citizen or a legal resident with 5 continuous years under your belt. No exceptions there. It's a rule rooted in how our system works, making sure Medicare serves folks who've put down roots here. Let me tell you about Maria, someone I heard about from a friend in California. She moved to the U.S. from Mexico 6 years ago, got her green card, and just turned 65. She's thrilled to sign up for Medicare because she's met that 5-year mark. But if she'd been here just 4 years, she'd have to wait. It's a detail that trips people up. So keep it in mind, especially if you or a loved one are immigrants building a life here. The parts of Medicare. Your healthcare toolkit. Now, let's unpack what Medicare actually is. It's not one big blanket, it's split into parts. each with its own job. Think of it like a toolbox, different tools for different needs. Here's the rundown. Part A, your hospital safety net. Part A is all about the big stuff. Hospital stays, skilled nursing facilities after a hospital visit, hospice care, and some home health services. It's the backbone of Medicare. And here's the best part. If you or your spouse worked and paid Medicare taxes for 10 years, 40 quarters, in tax lingo, Part A is usually premium-free. That's right, no monthly cost. It's like a thank you from Uncle Sam for all those paychecks. Part B, keeping you healthy day to day. Next up is Part B, your go-to for outpatient care. Doctor appointments, annual checkups, x-rays, blood tests, even that walker or wheelchair you might need, it's all here. Unlike Part A, Part B comes with a monthly premium. In 2025, most folks pay around $175 a month, though it can climb higher if your income's above a certain level. It's an investment in staying on top of your health. Part C, the all-in-one option. Then there's Part C, better known as Medicare Advantage. This one's a twist. It's run by private insurance companies, not the government, and it bundles Parts A and B together. A lot of plans throw in extras too, like vision, dental, or even gym memberships. It's popular because it's flexible, but you've got to shop around to find the right fit. Part D, prescription drugs covered, last but not least. Part D tackles prescription drugs, whether it's pills for cholesterol or insulin for diabetes. Part D helps keep those costs in check. Like Part C, it's offered through private companies, and you'll pay a premium that varies by plan. It's a must if meds are a big part of your life. Feeling a little dizzy yet? Don't worry, it's a lot to take in. Picture it like planning a cross-country road trip. You've got your map, Part A, your gas, Part B, an upgraded ride, Part C, and snacks for the journey, Part D. Together, they get you where you need to go. Enrollment. Timing is everything. Okay, here's where it gets real signing up for Medicare. This isn't something you can wing. Timing matters, and missing deadlines can hit your wallet. Let's walk through it. Initial Enrollment Period IEP. Your first shot. When you turn 65, you get a 7-month window, 3 months before your birthday month, the month itself, and 3 months after. That's your initial enrollment period. Sign up then, and you're smooth sailing, no penalties, no delays. It's like getting the early bird special at your favorite diner. Special Enrollment Period, SEP, life happens. But what if you're still working or covered by a spouse's plan? You might qualify for a special enrollment period. This lets you sign up later without penalties, but only if your current insurance meets Medicare's rules. Say you're a factory worker in Michigan with a solid union plan, check with HR to confirm it qualifies, and you're good to delay. General Enrollment Period, GEP, the last resort. Miss your IEP and don't get an SEP, you're stuck with the General Enrollment Period. January 1 to March 31 every year. Coverage starts in July. And here's the sting: late penalties. For Part B, it's a 10% premium hike for every year you could have enrolled, but didn't. That adds up fast. Take Jim, a retiree from Arizona. He turned 65, kept working, and skipped Medicare, thinking he'd sign up later. Problem was, his small company's plan didn't qualify for an SEP. Now he's paying more every month because of that penalty. Don't let that be your deadlines. How do you enroll? Easy peasy. Head to the Social Security website, give them a call, or swing by an office. If you're already getting Social Security benefits, you might even get enrolled automatically. Either way, double check, don't assume. Wow, we've covered a ton today, haven't we? Let's hit the highlights one more time. Medicare usually starts at 65, but disabilities or conditions like ESRD or ALS can get you in earlier. You need U.S. citizenship or 5 years of legal residency to qualify. It's got 4 parts: A for hospitals, B for doctor visits, C for advantage plans, and D for drugs. Enrollment timing is critical. Nail your initial enrollment period to dodge penalties. Medicare isn't just paperwork. It's about taking care of yourself or someone you love. Whether you're counting down to 65 or figuring this out for a parent, you've got the tools now to make smart choices. Healthcare's a big deal in America, and Medicare's here to help you navigate it. So, what's your move? If 65 is on the horizon, mark your calendar and check your eligibility today. If you're already enrolled, maybe it's time to see if your plan still fits. Don't wait. Peace of mind is worth it. Loved this deep dive? Hit that like button, subscribe, and ring the bell so you don't miss out. We're all about breaking down the big stuff. Healthcare, money, you name it, right here for you. Got a Medicare question or a story to share? Drop it in the comments. I'm reading everyone. Thanks for hanging out with me today. Wherever you are in this great country, take care of yourself. You've earned it. See you in the next video.